Hello, 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 and welcome once again to the How Do You Keep Well podcast, where we unlock the secrets to feeling amazing in your mind, in your body, and in your soul. And in this season of this podcast, we are focusing on women's health. I am Dr. Jaye. I'm your cheerleader, I'm your host, I'm your guide as we navigate the fascinating world of women's health and well being in this season. Now, if you're ready to laugh, like I always say, if you're ready to learn, if you're ready to take charge of your own health, you've come to the right place. Today, I'm joined by Dr. Bisi, and in a moment, she'll be introducing herself. But certainly, I know she's a doctor with many parts to her. I have followed her blog, I've followed her Instagram page, and I found it really fascinating how she shares skincare and tips about how to look after your skin. So, very soon we will be bringing her in so she can talk a bit more about herself. But just as a quick introduction of our topic today, which is skincare changes in midlife, um, I just wanted to know that you're not alone. A number of women go through different phases in their life where they lose their hair, they gain their hair, their skin changes from pregnancy to after pregnancy, and even acne, spots coming on their face when they don't expect it to. Definitely, you're not alone. By the time most women are in midlife, they have lost a lot of collagen in their skin, and the skin and the hair does not feel the same like it used to feel when you were in your 20s or maybe when you were teenagers. So, Dr. Bisi and I will be diving into this. We will be discussing some of our own personal experiences. I have a lot of personal experiences to share, and we will talk about the science behind these midlife changes, and most importantly, what we can do about them. So, everybody, please welcome Dr. Bisi Olaogu.
Thank you. Thank you for having me.
Welcome, Dr. Bisi. Thank you so much for joining us this afternoon. May I just get you to introduce yourself? Maybe what I would like to know, and I'm very eager to know, is your personal or your professional journey and how you have managed to combine two different roles as a medical doctor. I'm very, very curious about that.
Yes.
Uh,
Yeah, so hi everyone. My name is Dr. Olabisi Olaogun. I'm a medical doctor. I work mostly in public health and mostly currently reconstructive surgery. I previously worked in HIV, but I mostly work um, in reconstructive surgery now. Um, How did I get into skincare? I grew up with skincare. My mom has always liked skincare. My mom has always, taken care of her skin. So I was exposed to skincare at a very um, early age. So um, that way, I started taking care of my skin early. It's surprising to many people that I did not become a dermatologist or, do anything in cosmetology. But for me, even skincare is public health because anything that affects individuals should be like the health of individuals. We don't usually consider skin as an organ, but anything that affects it will eventually affect your health. And sometimes health issues can manifest on your skin first. So that way, I believe that skincare is very important regardless of your, specialty as a doctor. But currently, I I used to run a skincare blog, but currently, and I post on my Instagram page, that Gemini girl. But recently, there's been so much noise. So I, kind of step back. I'm observing what everyone is doing and also, taking it one day at a time, where if there's something I'm interested in, then I pay attention to it. But otherwise, that's me in a nutshell.
Amazing, amazing. There's so much to unpick from that, from your background with your mom, the influence of your mom in your your journey, but
Yeah.
also how you have learned to balance both your public and your private life, knowing when to step back. But
Hmm.
what I also find fascinating is what you say, that no matter what specialty you do as a doctor, you have to always recognize that the skin is also a vital aspect
Yeah.
of your medical field. And I think, when I came for this podcast, I actually came with notes, that my paper and my pen. Normally when I do my podcast, I'm just quite happy to write, to go with the flow. But in your own situation, I've come with paper and pen to learn from you,
I hope
because
I hope I meet your expectation.
I'm sure you will. Definitely, from what I have read about what you do, I'm sure you will. So very quickly, BC, I'm just going to go very quickly into what I call quick fire. So I'm going to
Okay.
ask you some questions, a few questions. Um,
Okay.
I'd just like you to give me some short answers. And then we will go into all the different other kind of discussions we have for our viewers
No
today.
problem.
The first question I have for you is, what is the biggest skincare myth you have heard, um maybe over the years?
Yeah. The biggest one, I would say it's honestly there's several, but I would say black don't crack. People say that a lot,
Mm,
but it's not true. It's basically how well you take care of your skin. There's nothing, even if you had great genetics, you may just need less effort. But black does crack if you don't take care of it.
mm, I like
Yeah.
that. And that's why I said I've come with my pen today, because I'm one of those people who have just assumed and taken things for granted with my skin
No,
until until my
no.
life changed after having kids. I'll go to the next question, because I can tell you're full, and I can tell you want to talk a bit more about that. But if
Okay.
I could go to the next question,
Okay.
if you could use only one skincare product for the rest of your life, what would that be?
That's a difficult question. First of all, I don't like to mention brands when I'm speaking publicly so that it doesn't seem like I'm endorsing anyone. But there isn't that one product. So that's another thing. So if you had asked me for the top three skincare myths, that would have been the second one, that people think that there's that one product, but there isn't that one product. But if they say you can only use one thing, I would just choose to wash my. So if they give me the option of still having bar soap for my body, which I can also use to wash my face, then I will pick sunscreen.
Wow.
A good moisturizing sunscreen is the
Mm,
one I would use. Yeah, or a good moisturizer is what I would
mm.
use. Yeah.
And and that is one area I feel many people may have missed the trick, because we all
Yeah.
assume, like you
Yep.
rightly said, that black doesn't crack. The sun doesn't
Yeah.
affect our skin. And
But
I
it
have
does.
I have my own story to tell about that. When I lived up north in Nigeria for some years, and I never protected my skin. But we'll
Uh,
come to that. We'll come to that later. So what the
okay.
next question is, what's worse for your skin? Not wearing SPF, or that sunscreen, or sleeping in makeup?
I'll say SPF. I'll say
Mm,
SPF. Not wearing SPF because sun damage is, so you see people who, they're darker, wrinkled skin, dry skin, and the minute they begin to take care of their skin, they automatically look younger. And sometimes they are even accused of bleaching, but that's because they've done things to reverse the aging and the damage. Not sleeping
mm.
in makeup, yeah, you can break out, not like it's good, but one is worse. But to me, you not wearing sunscreen at all is worse for your skin than sleeping in makeup.
In makeup.
Yeah.
Yeah, I think
Hmm.
we underestimate the impact of the sun on our skin, and
Yeah.
we don't realize how quickly it can cause a lot of damage. And it sounds like it's irreversible damage. Is that correct? Or is it reversible damage?
Well, it depends, honestly. It depends. Skincare is very personal. Skincare
Mm,
is so there are rules, and at the same time, there are no rules. So,
mm,
sun damage to me, so we might both be in the same environment, the same weather, the same intense sun intensity, but our skin will react differently. Some people burn easily, some people don't burn easily, some people, so it's so many factors and so many other things
that
that
link to it.
determine how your skin will react to, you know, adverse environmental conditions, or how it will react to a product, or all of those things. Yeah, so
Wow.
it's
Wow.
it's a lot of factors.
But the bottom line is always make sure whatever it is to wear sunscreen is
Yeah,
better to be safe than sorry, isn't
that's
it?
sorry. Yeah, yeah.
Mm. Now, this brings me to the next question. I hear a lot about collagen supplements. Do you think it's
Okay.
overhyped or do you think it's actually helpful?
Okay, so I actually like this question because I was one of the people who was like, collagen, it's a waste of time. However, I recently started taking collagen myself, and while it's not the miracle product for your skin, because as you know, I think you even said it earlier that you begin to lose collagen. Your collagen stores begin to deplete from like age 25. So you have to do things to stimulate collagen. People have said, oh, ingesting collagen does nothing for you, but recently they've started saying there might be some benefits. However, it does not replace you taking care of your skin, a good diet, and every other thing that contributes to healthy skin. I started taking collagen supplements not for my skin, but for my joints. And I noticed the difference with my joints, but I did notice a very tiny difference in my skin because that was the only thing that was different. My skincare routine has been consistent for
A
at
number
least
of
a year.
years.
Yeah, so I've used the same products for at least a year. So I knew it wasn't the product. It must have
Mm.
been something new. And I looked at what did I add? What habits did I change? And I saw that it was the collagen.
I find that really fascinating because I'm one
Yeah.
of those people
But
that you feel like,
you need to find a good brand. You need
mm,
to find a good brand that would, um, do what it needs to do because there's so many in the market. So you need
I
to
think
find a
that's
good one.
it's always so confusing because when there are so many things, you don't even know where to start from.
Exactly. You never know which one. One expert comes to say this is a good one, but you never know if they paid to say that. Another person comes that you trust, and then you get confused. And that's the problem with skincare as well. There's so much noise. There's so many people saying things. So you don't know who to believe. You don't know who to trust. So
Whilst we're still on that matter, what would you suggest to people if they are looking for a collagen supplement? What should they look out for, perhaps on the container or whatever, without necessarily mentioning any brand?
honestly, people just assume that, because you're a doctor, you know these things. But I also listen to like experts. So they'll say, oh, type 1, it should have type 1 and 2, and, all of that. But I just go with an expert I trust. I'm just being honest with you because I can say anything I read online now, but I
Mm,
just go with
with
what people I trust have said.
and
And it also depends on why you are, you know, why you want collagen. Because some people just do their bone broth and they don't take
mm,
any supplements. I
mm.
tried bone broth, which is basically, boiling bones with like herbs and veggies and, all of those things. And yeah, what you need it for, because I wasn't looking for collagen to help my skin. I was looking for
Mm,
collagen because of my joints.
mm,
And
mm.
it has really, really
M-
helped.
Made a
I'm
difference.
surprised. I'm surprised myself.
Yeah, those things come as a little surprise,
Yeah.
but you don't know until you try it. Now, I'll go to this question, and we'll talk a bit more about it as well. um is there any best anti-aging secrets? Many people, I personally am one of those people that always encourage people to embrace their age, but out
Yeah.
there people
Me
are
too.
always looking for the elixir for youthfulness. What can I use to make me look younger? Would you say anything like Botox, retinol, or any natural remedies? Is there anything that is the best anti-aging secret at all?
I said earlier that when it comes to skincare, there isn't one thing, there isn't the best. It is what is best for you based
Mm,
on your needs.
mm,
So when it comes to anti-aging, it's a lot of things. It's your diet, your lifestyle regarding stress management, sleep, because you can actually sleep at night and but not feel rested when you wake up. So your diet, your lifestyle, do you exercise? Do you sleep well? Are you managing stress? Do you have a skincare routine? Do you get, treatments as at when do you? So it's a combination of different things. Do you drink water? Do you do you eat? So that's even part of your diet. Do you eat junk food? Do you eat processed food? So that's a huge part of, skincare. People just think, let me get the products, tell me what works, and I would use it. But it's, as they say, it's holistic. It's a lot of things. It's not just skincare. It's so many things. You see women in their 40s, in their 50s, in their 60s that look really, really good, but they put in the work. They eat well, they exercise, they have a skincare routine, they go for their treatments, consistently, they manage stress, they ensure they get like 8 hours of sleep, and when they need to rest, they know when to rest. So those are the
mm.
things that will also help you um, age better, because there's no point. You can easily get treatments. There's no point having a smooth face, a youthful face, then you can barely get up from the chair by yourself. So your overall health is in shambles, but
Mm-hmm,
your skin
mm-hmm,
is smooth. There's just so much. Botox can only smoothen your forehead. It will
mm-hmm.
not do anything else for your entire body. So if you look at skincare as health,
Yes,
from a healthcare point of view, then
yes.
you would understand that it's not just skincare products.
Absolutely. I like that holistic view
Yeah,
of your skin health. And the skin health is just maybe, obviously, the skin is one of the largest organs in the body,
yeah.
but there isn't any point looking after your skin if you're not looking after your heart, if
Your
you're not looking after
entire
your
body.
bones,
Exactly.
if you're not
Exactly.
looking after everything that goes. Sometimes they say beauty comes from the inside,
Yeah.
isn't it?
Yeah.
So that
Yeah.
is really important. And all of those pillars you mentioned, diet, exercise, rest, managing stress, all of those play
Mm.
such a big role in
Yep.
how we manage our health, not just the skin health. But yes, I agree. Some people are so focused on products and produce and what to use and what not to
Exactly.
use.
They're not looking at every other thing. They're just focusing on the one thing. But there's no one thing when it comes to
Mm,
skincare,
mm,
especially when
mm,
you're in your 40s. You can get away with things when you're in your teens and your 20s. But by the time you
mm.
turn 30,
Yeah,
then you
you
have to really,
can't.
really be intentional.
Dr. Bisi, that
Yeah.
is one thing I always say to people that I come across, that you can't afford to be doing what you did in your 20s when you reach midlife. Because your body is changing and you have to go in tandem with that change. Otherwise, you will
Yeah.
get into big trouble by the
Yeah.
time you're in your 40s. And definitely what you put in your body, we in those years end up becoming what you are in your 50s. So if you don't take that time
Yep.
within those prime time, what we people call prime time of your life, you end up
Exactly.
suffering in
Exactly.
future.
So,
Mm, mm. So whilst we talk about our bodies changing in midlife, I don't know about you. I think for me, obviously I'm in my mid 40s now. But one of the biggest things I noticed was my hair. We're not going to focus on hair today, but I noticed my hair was thinning. And in fact, I had to cut it off at some point. So far, so good. My skin has been intact, but I know that the hormonal changes in the body can affect how the skin is
Yeah.
aging. What are your thoughts on that? Can you tell us a bit more about why the skin changes, perhaps the hormonal influence on our
Okay.
skin in midlife?
Yeah. So once a woman is, so now if you've been on social media, you know the in thing is perimenopause and menopause. It almost feels like people just started experiencing menopause. So I don't know if there's more awareness now or is the new money maker, because everyone is suddenly a menopause expert. And when you asked me to do this, I was saying I'm basically in my mid 40s, and people people tell me the things they've experienced. So I keep telling them that maybe I'm one of those people that will skip perimenopause and just be thrown straight into menopause, or maybe my symptoms are mild, and they mimic every other, because menopause is like a wide, maybe I'm sure it's like 200
This
symptoms,
is
where
the spectrum is so
you
large.
understand the really wide spectrum. At the same time, we need to be careful so we don't just assume something is menopause. I
Absolutely.
understand that, your joints, your skin is drier and all of those things, but we also need to be sure that we've ruled out everything else. So if, for instance, joint pain, you keep having this joint pain, it won't go away. Don't just say you're over 40. You need to have it checked out. So a part of me is worried that this whole focus on menopause will make them miss other medical conditions that could possibly be, you know, that could possibly
Causing.
impact the quality of life of women over 40. So we should just make sure that the minute you notice anything, please try to see your doctor. And I know people complain about finding a doctor, because I wasn't taught menopause in medical school. I wasn't taught nutrition in medical school. And for those who are now gynecologists, not even all of them can handle menopause, because what really happens is it's basically everything taking a nosedive. Estrogen, progesterone, testosterone, everything is taking a nosedive. And once those things take a nosedive, the levels are reduced in your body. They cannot do what they used to do. For instance, estrogen is linked to how your skin. So I try to make medical education as simple as possible, because people don't really care about the scientific stuff. They just want to know why. So basically, estrogen is responsible, it promotes water retention. The minute the levels are low, it retains less water, so your skin is dry. Once your skin is dry, it's dull. And if that hydration is all over your body, then of course, vaginal dryness is common. Testosterone, once it dips, your libido. So there's so many things, but basically it is these hormones taking a nosedive. And this effect will be seen on your skin, on your hair, and on your body. So most people, thinning hair, your hair is breaking more than usual, but at the same time, you are getting older. So all of the bad hair practices over the years will begin to show up in your 40s and your 50s. All of the bad skincare practices will begin to show up there, along with hormonal changes. So it's not like you can't cheat nature. You cannot, you know, health wellness your way out of menopause. It is a natural, yeah, you cannot wellness your way out of menopause. It is something every woman has to go through, and some people go through it naturally, and some people are thrown into it. For instance, if for some reason you need to take out your female reproductive organ, if you are 30, that means automatically you get thrown into
Into
menopause, and
it,
it is
into the
sudden.
deep end.
Yeah, unlike people who experience it gradually. But are there things you can do to make these symptoms better? Yes. But this is not something you start doing when those symptoms start. So, which is why I tell people, if you are 30 and you haven't started exercising, please start. I'm begging you. Please start, because you don't want to start at 40, 45 when there are aches and pains already. I've exercised for a while and maybe I've eaten relatively okay. I would say 60%. I'm aiming for 80%, but I would say maybe 50, 60% I've eaten well. That may contribute to how I'm feeling now, because
Potentially.
a personal experience is me having fibroids, and even as a doctor, I was trying to avoid surgery. But my scan before and after I decided to start a lifestyle change were completely different. When I still eventually had the surgery, I didn't escape it, but the fibroids literally dissolved. Why?
Wow.
I changed my diet. I've always exercised, but I changed my diet. Processed food, dairy, I took them out. So my blood level was in excellent condition. I had minimal bleeding. I didn't need any transfusion. My recovery was quick.
faster. Yes.
It was faster. Wound healing, all of those things. So when it comes to menopause, perimenopause, everyone is just saying, oh, exercise, take magnesium, do this. Yes, you will feel better. But if you are not perimenopausal yet, I would say still start those things.
Yes.
The things my friends are complaining about, I've taken notes, of them, and I'm doing things to prevent them. There's no preparation that would make you not experience hot flashes. However, it might reduce
the
hot flashes.
intensity.
Yeah, the intensity. So there are things they will tell you, oh, do this, that it has been shown to reduce hot flashes up to 90% in individuals. So don't wait till you're perimenopausal. Start today.
Start now.
Yeah. And don't try to do too much too soon. Walk for 20 minutes. Walk for 15 minutes. And people will tell you, oh, why can't, especially, outside of the skin changes, there will be increased accumulation of fat as well.
Oh,
this
gosh,
is also
yes.
linked to your diet. You might
Yes.
need supplements, because if your hair is breaking, it's brittle, it's dry, you might be deficient in iron, which is why you need to see a doctor. A blood work is important to even be sure it is perimenopause, because some people have their hormones intact. The decline has not started, but what they're experiencing is the effects of a sedentary lifestyle. This is not to say they might not be menopausal, but if you've done everything and you still feel that way, then you can say it's menopausal. And also you need to take note of how you're feeling so that you're able to articulate yourself to your doctor. If your hair is thinning, it might be your iron. If might be some people have even seen that it's low levels of vitamin D. That there's low iron. So once there's low iron, there's inevitably low vitamin D for some people. I've seen quite a few people who have said that. So you just need to be sure that you know exactly what is wrong first. Because you cannot just say, oh, I have dry skin and perimenopausal. You might be using harsh products. You might be using too many exfoliating products. That might be why your skin is dry. This is not to say you may not be in perimenopause. But I think we need to, but perimenopause and menopause, they are now those things, when people do something bad and they say it's the devil. So perimenopause and menopause have now become the diagnosis for
buzzword.
for every single thing. Exactly.
It's my
So
menopause.
exactly. So you need to be sure, you're on the right
And
track. Yeah.
I really, 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 I couldn't agree with you more, Dr. Bisi, because the word out there is, yes, menopause causes so many things, and people are not taking time to actually go out to seek help in the right places, and they
Hmm.
are reading online, following influencers, and I always say to
Exactly.
people,
TikTok.
it's a personalized care. You can't. Every woman is not the same. What works for one woman might not work for you, and what
Yeah,
one woman has may not be the same as what you have. So it's really
exactly.
important to
So
get help from professional people. And you may find that, yes, those changes you're noticing in your skin is your wake up call. It might be that, yes, once you begin to notice it, now you have to do one of three things. Like what Dr. Bisi said, well, you have to go and get the right professional help. You may need some
yeah,
blood work. You may look at what you're doing with your lifestyle. And if you still
exactly. Yeah,
try any of those and it's not making any difference, then you can begin to explore, other options. But one of the biggest things you said to me is you can't cheat nature, because
yeah,
what you haven't avoided, what you haven't worked on, what you haven't, dealt with before time, it will begin to show up in future. And I always say to people, look, menopause is just like the window of what is happening in midlife. You're aging, your body is aging,
yeah.
no doubt about it. Your hormones are
And you should
aging,
be
and it's
thankful. You should be thankful for that, that you even have the
def-
opportunity to experience that. You should be happy.
definitely that is almost like a clock in your body that tells you, look, this is the time to start really looking after yourself, even if you haven't been looking after yourself before.
Yeah,
But we do know that it's not just estrogen or progesterone or testosterone. We know there's thyroid hormones as well, and cortisol.
exactly,
So many
exactly.
different.
There's so many things. It's your body is like a machine. It needs to, even a machine, there's wear and tear if you've used it, for so
Definitely,
long. So yeah,
definitely.
it needs maintenance.
It does. And I say to people, if you want a pair of shoes, especially when I talk to people about their joints, I say to them, if you want a pair of shoes for 40 years, every day you wear it, there's going to be wear and tear. So if you don't look after the shoe, make sure you take it out for maintenance, you're just going to find that one day there's a hole in your shoe and you can't wear it anymore.
Or the toe comes off. Yeah.
Definitely. So I'm just going to go to maybe one or two specific conditions. You talked about estrogen, how it helps our skin to retain water. And once the levels start dropping, you may notice that your skin is dry and all sorts of things. What about things like acne? People just will kind of have acne returning in
Yeah.
midlife, or something like dermatitis. That's when there's a rash around the mouth or redness
Yeah.
around the mouth. And I know people go and buy things over the counter, go and buy steroids and start putting it on their face, expecting it to go. What are your thoughts about midlife
For
acne?
acne, for acne, acne is lifelong. So you find out that those people may have dealt with acne earlier on, or some people then start breaking out later in life. It's all down to the hormonal changes. So you never know what menopause or perimenopause is going to throw at you. Some people have never had a breakout. They didn't start breaking out until they were in their 40s. This is why a personalized consultation is important. Don't just use something because someone is using it. For the perioral dermatitis, it can be caused by anything, and people often confuse it with acne. Some people, it could be their toothpaste. Some people, it could be chewing gum. Some people, it could be skincare products they've used. So they're two completely, different things. Perioral dermatitis happens around the mouth, but acne
Mm,
can be anywhere. Some people start getting on their chest, on their back, on their face. Some people, it's strictly along their jawline. But people who never used to break out, and sometimes you might not even be menopausal or perimenopausal. You might just get on birth control. You're in your 20s, you get on birth control and you start breaking out, which is weird because some people use the same birth control to treat their acne. But
acne
that's the beauty of the human body. Everybody responds differently to
differently.
different things. Yeah.
I think that for me rounds it up to every woman listening to this, or husband or brothers
Yeah.
or men, that when you find your women complaining about their skin or about what they've used, other people have used, and it's not working for them, I would encourage you, try to get professional help, because your care is your own health. It is not about what has worked for somebody else or should work for you. Your skin is going to change, your body is going to change. That is expected
Yeah.
because you're aging. If you were a machine, the parts would wear out. If you were a shoe, the shoe will wear out. So it's really
Yeah.
important to kind of take that preventative approach. You
Yeah.
know,
That's the word.
work kind of work on your diet, your lifestyle. Now, Dr. Bisi, because we're nearly rounding up now, just before we do, you've talked about diets. Are there any specific kind of diets that you would recommend? That people, maybe, obviously we all eat different things at the same time, and I know you've talked about processed food, which I know for many, I mean, I say to people, when I was growing up in Nigeria, we only had maybe Mr. Biggs or something like that, maybe, and Kingsway. But now there are so many, many, many outlets selling so many processed food. It's just unbelievable. So what are your thoughts generally about diets that we can maybe focus on to help to improve
I think
our skin?
I I personally think there's no over 40 diet. Everybody should eat vegetables, fruit, except you are allergic to fruit and vegetables. Just pick the ones you like. Don't eat broccoli or cauliflower and it bloats you because everybody's eating it. Find the ones you like. Vegetables, fruit, eat your protein and minimize refined carbs. So for instance, a typical day, eggs, of course, we know now that eggs and cholesterol is not what we used to think it was. That you can actually eat eggs without worrying about your cholesterol. You can have eggs for breakfast, a slice of sourdough bread. Make sure you have like tomatoes, spinach, onions, all sorts of mushrooms in your eggs, so that it will bulk up the eggs and it will fill you up. You can have like your tea or your coffee. Your coffee, many people will say they're drinking coffee, but they're actually drinking milk and they'll put loads of sugar in it. But you can have your green tea, you can have your coffee, minimal sugar or artificial sweetener if that's what you like. Just make sure every meal has vegetables and a protein, because protein are kind of like building blocks. Those are the things that give your skin that elasticity. It gives it keeps you fuller for longer. It gives you like, energy. That way, once you are full, you don't snack. Is
Mm,
when you're still hungry, you start eating like different things. And
mm, mm,
by the time you are that age, you should start strength training. And
mm,
protein will help fuel that strength training. So
mm.
protein and vegetables are very important. This is not the time to cut out. You need carbohydrates for energy. But it's not like you'll be eating like agege bread every day. You can eat rice, you can eat pasta, you can eat potatoes. So a lot of the carbohydrates have been demonized. You can eat eba, you can eat amala. Nigerian food is one of the healthiest to me. But how we make it, if you make your stew with so much oil, you've defeated the purpose. If you eat too much salt. So you have to make sure that your plate is balanced. And fiber as well. Everyone talks about protein, carbohydrates, and fruits and veggies and all of that. But nobody talks about fiber because your digestion is important. Fiber would also keep you full. So you have to include fiber, and you can get fiber from your fruits and your vegetables. You can also get it from other sources as well, but you must include fiber. Pay attention to your protein and your fiber, especially if you are over 40. Drink lots
Um,
of water, reduce processed food, reduce, liquid calories, your soft drinks, your specialty coffees, alcohol. We've been told that there are no safe levels of alcohol, and alcohol is possibly, it will worsen the symptoms. It will worsen your,
Mm.
it worsens everything. It will worsen acne. It will
It
worsen
does.
rosacea. It will
It
worsen
does.
perioral dermatitis. It will worsen menopause symptoms.
It
It will
does.
worsen
It does.
PCOS symptoms. So alcohol should be, if you can't do without it, it should be really, really minimal. Maybe once a week at most. A
Mm.
glass of
Mm.
wine a week at most. At
Mm.
most.
Mm.
Yeah.
Amazing stuff. I think that summarizes everything. People talk about going on a diet, and I always say to me, what? You don't have to live your life in so much restriction as long as you stick to some basic
Exactly.
rules, which you have, kind of broken down in such simple way. I do hope people hear this message. I mean, Dr. Bisi is a qualified medical doctor. She knows what she is talking about. I completely agree with 100% of what she has mentioned. And definitely living life in moderation, is the bottom line of all of these things. If you learn to live life in moderation, stick to some basic rules of eating at least 5 to 7 different type of vegetables every day, your fiber, your fluid, and you should be doing, I mean, your muscle strength training. All of this all adds up. We are rounding up now. I'm so grateful, Dr. Bisi. Thank you so much for your time. Thank you for,
Um,
just giving it to us very raw and direct, in a very simple, understandable way as
um,
well. And the message I'm taking from all of this is that skincare is not something you start doing in your 40s or in your 50s.
yeah. You
You
have
start
you have to
doing
start. You have to
way
so if
before.
you've not started, regardless of your age, start now. Have a
Mm,
morning routine, have an evening routine. In the morning, you are focused on protecting your skin. At night, you're focused on repairing your skin. You wash your face in the morning, a vitamin C serum to protect your skin from free radicals during the day, good moisturizer, and sunscreen. It's a must. You don't
mm,
even have to use a vitamin C serum. Any antioxidant serum, it can be vitamin E, it can be ferulic acid, any one at all, green tea extract, it can be any one at all. But antioxidants in the morning, moisturizer, and sunscreen. If you also want to use niacinamide in the morning, that's fine. At night,
mm,
if you want makeup, you'd need to have a makeup remover to take off that makeup. Because
mm.
really, imagine would you put your food in a dirty pot? No.
No.
So
Mm.
the skincare needs to be on clean skin.
Skin.
Take off
Mm.
your makeup, then wash your face. Use any makeup remover like micellar water or anything like that. Then wash your face. At night, you're focused on repair. And remember, I mentioned that your skin starts to lose collagen from like age 25. So you have to use things that will stimulate collagen, which is your retinol. So, and remember, you're also battling with dry skin. So this is where you can use maybe like a peptide serum followed by, or a hyaluronic acid serum. Hyaluronic acid serum will hydrate, your skin. Drinking water is not enough. I will be honest with you. I'm sure you've heard that before. People, you ask them the secret to clear skin, they'll say they drink water. It's not enough. So you use a hydrating serum to hydrate your skin. Oil does not moisturize your skin. So you need to get a moisturizer. So you can use so you take off your makeup, wash your face, a peptide serum, retinol serum, at least 3 times a week. If
Mm.
you need treatments, please don't be shy. Don't let anybody shame you into getting treatments because there's just so much the creams can do
Nice.
to reduce deep lines. So if you have deep lines, you may need filler, you may need some type of treatment. Please do not hesitate to get them. If you have deep wrinkles on your forehead, you may need Botox. But the
Mm.
one skincare concern most people will have, apart from the lines and wrinkles, is hyperpigmentation. So you may need to get like a gentle chemical peel. But at the same time, you can't get a chemical peel if you're not going to wear sunscreen because you'll be right back to square one. So
Mm.
it can also be micro needling if you have some scars. If you have skin tags, you can get them taken out. If you have, so if you then have pigmentation, but it is due to a secondary cause like diabetes, they have to sort
Mm.
out the diabetes, then the pigmentation will go away. So you can see that there isn't one size fits all. It's based on what you're experiencing, what your skincare concern is. So if, for instance, Dr. Jaye is saying, tell me what you use so that I can go and buy it. No, that's not the way
Mm.
to go. Your skin
Mm-hmm.
concerns are different. It's not because I'm light skinned and she's dark skinned. No. Skin
Mm-hmm.
is skin. But the thing is, our concerns might be different. Mine is pigmentation
Mm-hmm.
and dryness. Hers could be something else. So we
Mm-hmm.
would both need different products, which you can only find out through consultation.
Consultation.
There's so many people who can do consultations for you,
Yeah.
and then they will curate a skincare regimen that you should follow. It's pointless going for consultations. They give you your skincare routine and you don't follow it.
No, no. There's no point
So
taking you to the water and just, you just sit down
exactly,
there.
yeah. So that's just basically it. For the hair, you have to minimize. I'm saying this wearing a wig, but I know that also affects,
People suffer with
your edges.
edges.
Go to a salon that they know how to handle your hair. Those
Mm.
tiny braids, you can't get away with them anymore.
Mm-hmm.
Because nothing makes you look old than you not having edges.
Absolutely.
You will look older than you actually are. Or when
Yes.
your skin is like sun damaged, dry, and wrinkled, you will look
Yes.
older. So these
Definitely.
are things that are inevitable, but it's
Can be
doable.
worked on, can be,
Yeah,
there are things you can do, one, to prevent it. And once you begin to see the signs, don't ignore it, go and
yeah,
get help. There
yeah.
are people out there who can help you. And again, I'm sure there is a lot of ways you can find out about people out there who can help you. If you need, for example, we are going to round up now. Dr.
Okay.
Bisi, is there anywhere, if people want to find out more about you, or perhaps maybe book a consultation with you of some sort to guide them, is there anywhere in particular they can find you, or follow you? Is there anywhere in particular they can meet with you, or your clinic, or anything like that?
So for skincare, I do not offer consultations anymore. And but on Instagram, if you send me a DM, I can recommend places you can go to.
Wow, that would be
Places
so lovely.
places I also go to. Then if you don't want to go to the clinics, there are people who provide those services on Instagram, but it's a formal process. So it's not like you'll be chatting via DM. You also book a consultation with them, but it's not the typical clinic, setting. It
Setting.
could be over Zoom and,
Yeah.
yeah,
That sounds doable. That sounds doable. Thank you
yeah.
so much. Thank you so much, Dr. Bisi. I've learned so honestly, it's just so eye opening. Personally, for me as a woman going in my 40s, and I've not been someone who has looked after my skin. I'm beginning to think, well, like you said, it's not just enough to drink water. That really
Mhm.
stuck me. That really
Yeah.
stuck to me. Like, you can't just say you're drinking water, just using bar soap to wash your face and just think that's enough. Those are things that have really stuck with me from our conversation today. Thank you so much. I'm very, very grateful. Hopefully we would speak to each other a bit more, and hopefully we can always get people to contact you
Mhm.
via DM and not overwhelm you, because I know you're very particular about getting the right balance. So thank you. That's it for today, my viewers. So please share this. You can see the amount of information we have discussed on this afternoon. I would like you to share with your family, your friends. Somebody out there may need to hear this so they can start looking after themselves better. Please please follow Dr. Jaye, Dr. Bisi online for more information that is medical and recommended. And thank you so much for listening. Have a good evening, everyone. Bye.
All right. All right. Thank you.